Welcome to today's call with Congresswoman Joyce Beatty. During today's call, we'll be taking questions from constituents like you. To ask a question, please press star 3 now. Again, if you'd like to ask a question, please press star 3. You may also sign up for the Congresswoman's e-newsletter by pressing star 6 at any time during the call. Again, please press star 3 to ask a question or star 6 to sign up to her newsletter. With that, I'll now turn it over to Congressman Joyce Beatty.
Well, thank you and good evening to everyone. I'm Congresswoman Joyce Beatty, proudly representing Ohio's 3rd Congressional District. And thank you for joining us tonight. Welcome to our virtual town hall, straight talk on the shutdown and healthcare crossroads. Across Ohio and across America, families, small businesses, and federal workers are feeling the effects of this Republican government shutdown. And tonight, I am honored to be joined by my colleagues, my friends, members of Ohio's congressional delegation. We have Congresswoman Shontel Brown from the Cleveland area and in Ohio's 11th congressional district. We have my colleague, Congressman Greg Landsman from the Cincinnati area in Ohio's 1st congressional district. And we have Congresswoman Emilia Sykes from the Akron area in Ohio's 13th congressional district. You will hear from them. They will share comments and we'll answer questions because we're here to discuss and answer your questions about the Republican shutdown and healthcare crosswords. Talk about what's at stake, what's being done, and how we can help our communities navigate this moment. And I'm sure my colleagues join me, and we would be remiss if we did not say thank you to our leader, Congressman Hakeem Jeffries, for being out front, for leading us, and not backing down. We have a strong message, and we're ready for this fight because we're fighting for you. So let's be clear. Republicans refuse to negotiate a government funding package that protects your health care. They would rather hold the country hostage and give billionaires tax breaks rather than preserve affordable health care for everyday Americans. Democrats are fighting to stop healthcare cuts, lower costs, and save healthcare. So here's how tonight will flow. Each member will again introduce themselves, tell whatever they want to say about themselves. This is just going to be a family dialogue with you, and they'll share some opening remarks. And then our moderator will lead a Q&A, taking questions that some of you submitted earlier and others live on the line tonight. So let me just start with a few brief remarks. As you may or may not know, on October 1st at midnight, the Republicans shut down the government and they've not shown up to work. They're traveling on vacation. And since then, Democrats have been right here in Washington, holding press conferences, hearings, and other engagements, highlighting stories of healthcare crises, including the hearing right here in Washington I participated in just a couple hours ago. My colleagues are in their districts, touring sites, meeting with constituents, and letting them know that we're fighting for them. We've been in our districts, connecting with healthcare providers and patients to sound the alarm about what's at stake. For people to understand the real life stories behind our stand for healthcare. Let me just give you an example in my district. A family of 4 making almost $130,000 will see their healthcare premiums in the Affordable Care Act marketplace jump to some 80%. Republican constituents are actually responding with calls to our offices. Some Republican colleagues are responding with public concern around the healthcare crisis because, see, this is hitting everybody. But this clearly has not been enough to move them to negotiate these protections. So here's what we need your help with. We have a strong message, but we need to keep the pressure on, and we can't do it alone. This is your government. This is your health care, and all elected officials in Congress should know how important they both are to you. It's important to hold them accountable as part of the democratic process. Now, we'll begin with opening statements from my colleagues, where they will introduce themselves. Following open remarks, we'll start taking your questions from the moderator. So, we're going to start with my friend, my colleague, Shontel Brown from Cleveland, representing Ohio's 11th congressional district. Shontel, I yield the floor to you.
Thank you, thank you, thank you. Good evening, everyone. I'm Congresswoman Shontel Brown, and I'm proud to represent Cleveland and the surrounding Northeast Ohio communities in Congress. First, I want to thank my friend, Congresswoman Joyce Beatty, for bringing us together tonight. Joyce has always been a powerful voice for Ohio families, and I'm proud to stand with her and our Ohio colleagues, Congresswoman Sykes and Congressman Lansman, as we fight to protect affordable health care. Democrats are ready to pass a bipartisan budget that funds health care and lowers costs for families, but Republicans have refused to even come to the table. Instead, they've canceled votes for five straight weeks and shut down the government, all because they'd rather protect tax breaks for billionaires than protect health care for working families. Here's what's at stake. First, the enhanced premium tax credit that help people afford coverage are set to expire at the end of the year. If Congress doesn't act, premiums will jump about $700 per person. A family of four in Cleveland making around $56,000 a year, that's about the median income in my district, would see the premiums rise by $2,400 next year. That's like another mortgage or rent payment. Second, back in July, President Trump and Republicans passed their One Big Ugly Law. It cuts $1 trillion from Medicaid to pay for tax cuts for the wealthy. That is the largest cut in our nation's history. It also created new work requirements that could push thousands of Ohioans off their coverage. Here's what that means for us: higher costs and people losing care. When open enrollment starts in 2 weeks, more than 500,000 Ohioans could see their premiums skyrocket if tax credits aren't extended. And more than 430,000 people could lose their health insurance altogether. About 183,000 losing Affordable Care Act coverage, and about another 250,000 losing Medicaid. That's nearly 500,000 of our neighbors suddenly without the care they rely on. So Democrats are ready to vote today to reopen the government, extend the credits, and stop these cuts. We're ready to work across the aisle for a fair budget that protects working people and keeps health care affordable. But we won't support any plans that raises costs or strips health care from Ohio families. Lastly, we're also here to talk about what this shutdown means for the people of Ohio. I have an FAQ page up at shontelbrown.house.gov, and I know my colleagues have similar pages up as well. Now that Republicans have kept us shut down for 22 days, we have already had millions of federal workers miss paychecks. It's just terrible that this has happened. We have information on how to file for Ohio unemployment insurance on our FAQ page. I would also encourage you to contact your bank and ask if they have no interest or low interest loans available. Navy Federal Credit Union, USAA, USECU, and a number of other credit unions that serve federal workers are offering interest-free loans. Tax and which are going to be in real jeopardy starting next month. If you are worried, I would encourage you to contact your local food bank, including the Greater Cleveland Food Bank in my district. But the bottom line is this: we can fix this. Congress just needs to do its job. End the shutdown, protect affordable care, and get back to delivering for the people we serve. And with that, I want to hand it off to my colleague, Congressman Lansman. The floor is yours.
Thank you, Congresswoman Brown. And I want to say thank you to Congresswoman Joyce Beatty for pulling us all together. Thank you to everyone who's engaging, obviously to my colleagues, to I'll be quick. I am frustrated. My colleagues are frustrated. I know you all are probably frustrated by a whole host of things that are happening right now. Uh, the shutdown and this fight for healthcare are two really important pieces that have to get resolved as quickly as humanly possible. All of us represent thousands, if not tens of thousands, of federal workers. Most federal workers live outside of DC. 85% of federal workers actually live in our districts throughout the country. And we care deeply about them and want to ensure that they are getting paid and that their jobs are protected. And then the healthcare piece is part of a larger issue related to costs. As you all know, costs are going up, whether it's groceries or housing, utility bills are on the rise, and now healthcare costs are going up, and they're about to skyrocket if we don't take care of these Affordable Care Act subsidies now. And so we're asking and pushing for one vote, a vote to reopen the government and protect people's health care. In my district in Southwest Ohio, Cincinnati, and the surrounding areas, we're talking about 3,200 people, 32,000 people who will see their healthcare premiums skyrocket. 14,000 of my constituents will lose their healthcare altogether, which is obviously unacceptable and why we're fighting so hard. For a family of four, and this was a question that came in, earning $64,000 a year, their premiums will go up by $2,600. For a family of four earning $130,000, so not a ton, but probably what a lot of families are going to be facing. Their premiums will go up by over $6,000. It's just not affordable, and so that's why we're fighting to ensure that these healthcare subsidies are extended. Obviously, the Medicaid cuts are also hugely important, and we've got to make sure that those don't take effect either. The ACA subsidy fight is happening now because November 1 is open enrollment, and letters are already going out to folks saying, because we are no longer getting the support from our government, you're going to have to pay twice as much, if not more, for your health care at a time when we know folks can't afford that. So that's this fight, and I'm glad to be. Not glad to be. I'm just certainly convicted in terms of this fight, and really appreciate my colleagues, Leader Jeffries and others, and all of you again for jumping on. And with that, I'll hand it over to my colleague from the Akron area, Congresswoman Emilia Sykes.
Thank you, Congressman Lansman, and thank you, Congresswoman Beatty, for bringing us all together to talk about this incredibly important issue, the shutdown. I'm sure everyone is hearing a lot about what is going on or hearing questions about what is going on, and this is a great opportunity to get us together. And of course, to Congresswoman Brown, it's good to be in community with every last one of my colleagues from the Ohio delegation, at least the Democratic side here. My name is Emilia Sykes. I represent Ohio's 13th Congressional District in Northeast Ohio, the birthplace of champions, and this is another opportunity for me to talk with constituents not only in Northeast Ohio, but all over the state. And so this is such an incredible opportunity, not only for me to share information, but for us to hear from you and make sure that we are doing what you all need us to do to make sure we're getting this government back open and eliminating the crises that the Republicans created with our health care. Now, a lot of people think that this crisis started and this shutdown started on October 1st. And while that is technically true, we saw the impacts and the effects of the One Big Ugly Bill, which started and is the genesis around this healthcare crisis. And I'm going to use my district as an example because we are very reliant. Our local economy is incredibly reliant on healthcare. Our largest employers are healthcare systems. And without a reliable reimbursement system, we are going to suffer. So, for example, the One Big Ugly Bill takes about $1 trillion out of the Medicaid program. We have a children's hospital in the district, which is heavily reliant upon the Medicaid program. And once you start taking that much money out of the healthcare system, not only does that mean that our care is going to suffer, but the people who provide that care, our doctors, our nurses, the folks who clean and make sure that the hospitals are running in IT and all of those different capacities, as well as folks outside of the hospital that provide resources and services to these hospital systems. Our local economy will be devastated with the one big ugly bill. Then, to add insult to injury, we started to ring the alarm about what was going to happen if we did not expand the Obamacare, the Affordable Care Act subsidies. Now, the one big ugly bill made permanent tax cuts to the richest people in this country. These are the folks who have private jets, who have yachts, who can go on vacation for a month, like my Republican colleagues. Their tax credits were permanent. But if you relied on an ACA subsidy, like 29,000 people in my district, that was going to expire, and that is going to expire on December 31st of this year. 90% of the 29,000 people who rely on the Affordable Care Act marketplace rely on the subsidies. And so that is going to be incredibly problematic for the people in Ohio's 13th district. But what that means in real life is that these families may not be able to afford healthcare coverage. And with the cost of gas and groceries and housing and now healthcare going through the roof, people are just not able to live a quality life without getting either more pay or something else having to happen. And so that is why you're seeing Democrats hold the line and just say, this is unacceptable. Our constituents cannot afford to live in this country. There are things that we can do to make it better, and we are demanding our Republican colleagues to join us in making that so. One thing that we found back in July when the one big ugly bill was passed, AltCare, which is affiliated with the healthcare system in my district, immediately announced that 6,000 people were going to lose their coverage. 6,000 people. This was back in July. And these are individuals and small business owners who relied on those plans to make sure that not only were they covered, but they could cover their employees. And that was even before we started this shutdown conversation. So just so you all know, this has been brewing. This is not new. We have been asking and sharing and highlighting to our colleagues what was going to happen, and they have continuously ignored us. Before I turn this back over, because I know you all have a lot of questions, and that is the most important part here, my office remains open and available to help. I have been in DC every week. I just got back yesterday, hoping to find a Republican who might be willing to talk so we can start these conversations going. And I know that everyone on this phone call has been in DC throughout this short shutdown to make sure that we are actually doing the work that we need to do. But in the meantime, if there's anything that I can do or my office can do to help assist you, please visit us at sykes.house.gov. We have a shutdown page and a frequently asked questions. It is translated in 5 languages, including Arabic, Spanish, and Nepalese. And so if you need that information or you know someone who may need it, please visit us at sykes.house.gov. So those are the opening remarks. I think we've got a ton of questions to get answered and very much looking forward to hearing from you all.
Thank you so much to all of my colleagues for your opening statements. And certainly, I hope the general public, those watching in our districts and not in our districts, will really know why we're in this fight and what's at stake. And that's the purpose of this, to make sure that our constituents, one, understand that we are doing our job. As Congresswoman Sykes just said, what she's been doing, Congressman Lansman and Congresswoman Brown, they have been in their districts. They've been in Washington. We're going back and forth, business as usual for us. But it is so important for us to highlight Republicans are nowhere to be found. And that's another reason we want to share with you and answer your questions so you know we're in this together. And it's going to take all of us to keep that pressure on and to make sure that you're asking the same questions to our colleagues on the other side as you're asking us. And I think we may have some questions that we can go right into.
Yes, Congresswoman, thank you. And a reminder to everybody, if you would like to ask a question on tonight's call, you can press *3 now. And if you would like to join the Congresswoman's e-newsletter, you can press *6 at any time. We'll go ahead and start with a written question for Congresswoman Beatty. Carol from Columbus asks, how is the shutdown affecting the fight to save healthcare?
Well, thank you, Carol, for that question. I think the fight is helping us because, one, it's allowing us to get our message out. And it's so important for us to share that the loss of healthcare will affect from the least of us to, let's say, for example, a family in my district, a family of four, maybe parents and two children who are making, let's say, $130,000 a year. They'll see their health care costs increase by $8,800 on an average. And so I think it's important for us to let you know that during this shutdown, that's what we're fighting for. We're fighting for you so we can reduce the cuts, allow you to continue to have health care and to protect your health care, because we know Republicans have the power to fix this. And we're putting the pressure on, and we know it's working because we have to continue because they're not doing anything. They're not helping us. And in plain language, we're fighting to make sure that we get those extensions. It means there's specific rules, there are protections or fixes. And I think earlier my colleagues were talking about the legislation in the bill. Our shutdown is because it's not what's in the bill, it's what's not in the bill. And those are the things that you've heard us talking about. And lastly, let me just say, to put this in perspective, roughly 20 million people will be affected by this. And so we're getting the attention of our constituents during this shutdown, and we're allowing them to know that we're asking them to join in the fight with us, to put the pressure on everybody that's not coming to work, everybody that's not standing with us. And during this shutdown, is so important for us to make sure that we tell you Speaker Johnson is at fault. He controls the gavel. He should be calling us back into work. He should be sitting down negotiating with Leader Hakeem Jeffries, his members, delegation members in Ohio. Shame on them. They should be coming to work. And thank you, Carol.
Thank you, Congresswoman. We'll go ahead and move to a question for Congresswoman Brown. Angela from Cleveland asks, is there a plan to educate and connect with rural Ohioans?
So thank you for that question. I think it's actually a great question, and it's something that I think a lot about as a member of the Agriculture Committee. This summer, I actually did a farm tour across Ohio, and nearly every place that we went to, we talked about healthcare. It is so important. In fact, about 27% of farmers are on the Affordable Care Act plans. So it's huge for rural America. And I guess that's the irony. This is not an urban or a rural or a blue or red issue. We all need healthcare. And the cuts they are pushing are so massive that they hurt everyone. So we have to go everywhere, talk to everyone, and listen. We have to listen to everyone. Um, just as another note, I ran an op-ed at foxnews.com last week on Trump's war on farmers. So I'm going to do my part. I'm going to keep spreading the word and keep educating them and informing them and keeping them abreast of the policies that have been adversely impacting their lives and figuring out ways to earn their confidence and trust so that we can win their votes.
Thank you, Congresswoman. Congressman Lansman, we'll send you this next question. We have Cassandra from Springboro who asks, what can we do to help restore sanity to the government?
Well, thank you for that, Cassandra. It is so important that we do this, ultimately get back to a place of structure and reliability. That's just been chaos for the last 10 months. And arguably for years, our politics has really evolved. And the expectations for politicians are pretty low. But here are, I think, the basics. And if we push people to do the following, one, they should be able to accomplish it. And two, I think it would help restore sanity. One, we need to push everyone to go to work, right? Like, it is insane to me that the House has not been open for a month. The Speaker refuses to bring us back, and so we can restore sanity by saying, like, just work. We need everybody to be back in DC working on this issue to reopen the government, protect people's health care. Number two is we need people to get in a room and negotiate. That is pretty basic. And the president can order his congressional Republican leaders to do that. Right now, he's saying don't negotiate, don't work with Democrats. That is the barrier. I mean, they should do it on their own. They don't need to be told by Trump to do this. But unfortunately, that is the case, in that they need him to say it, and why not? That's pretty basic. And then once people are in a room negotiating, they don't leave until they have a resolution. All of us would support that, and that's all we're asking for, is for them to show back up, get back to work, get in a room, and do what we've always done, which is work through these things in a negotiation, and then get a resolution, vote on that, reopen the government, protect everyone's health care.
Thank you, sir. Our next question is for Congresswoman Sykes. Rebecca from Hudson writes in, how do Democrats in Congress plan to address SNAP funding alternatives should the shutdown continue into November?
That's a fantastic question. And thank you, Rebecca, for engaging with us. So the first thing I'll say is this is not just an issue for Democrats. This is an issue for Republicans as well, because all of our constituents are relying upon the SNAP program. And if we don't fund the government, we don't come up with a solution by the end of October, about 1.5 million people in the state of Ohio will not have SNAP benefits. And just in case anyone doesn't know, SNAP is the food assistance programs. That's about 115,000 folks who won't be able to put food on the table in our district. And those are children, veterans, seniors, across the gamut. A lot of people are going to suffer. So I'm, as you know, Rebecca, someone who is about solutions. And in feeling like we were getting close to a shutdown, I introduced a bill called the Feed Our Families Act, and it would set aside 3 months of funding just to cover SNAP reserve funds so that the United States Department of Agriculture, the USDA, could continue to feed our families. And thankfully, Congresswoman Brown co-led that bill with me. We've introduced that in every other shutdown scare that we've had, because we know that people are going to suffer if we don't open the government. And we only have just under a week to make sure that this does not happen. And I'm just going to make it as plain as possible. People will go hungry. While SNAP benefits are very helpful, most people are only getting about $6 a day, but that $6 a day is really impactful for families who need it. And again, I'm talking about our seniors, children. Children are a very large portion of beneficiaries of SNAP, as well as our veterans who are going to suffer. One other thing that we can do, because again, we're looking for solutions here, is our delegation, our Democratic delegation, everyone on this call, and Congresswoman Capter wrote to Governor DeWine asking him to use state resources to keep SNAP and WIC, the Women, Infant, and Children program, funded while the DC Republicans work this out. We are still waiting a response from that letter, but the state does have the opportunity and the ability to fill in the gaps if they choose to do so. So we are nudging them and encouraging them to do that action so that people don't go hungry. We've also been working with our county executive and our local elected officials to make sure we know what's happening, and recently participated in a food bank for federal workers earlier this week and engaging with the food bank so we can get that information to people. But bottom line is this, we don't have to be in this position if everyone decides to get their job done. Going back to Cassandra's question, reinstituting sanity. You have to get to work. We just saw President Trump say he's refusing to talk to Democrats until whatever new date or thing that has to happen. He has talked about being the negotiator in chief, the best negotiator in the world. And we need him to engage and start directing Speaker Johnson, because we do know Speaker Johnson takes a lot of his cues from President Trump. We need them to get together so that they can start this process. And this is going to be something that is going to take the Republicans to join us. If we could open up the government, we would do it as Democrats. But this is a Democrat and Republican issue. And let's not forget that the Republicans have the majority in the House and in the Senate, and they control the White House. So we're ready to work whenever they are. And we definitely want to make sure no one is going hungry. But thank you for that question, Rebecca.
Thank you, Congresswoman. We'll move back to a question for Congresswoman Beatty. We have Isla from Columbus who asks, what are you all actively doing to bring an end to the shutdown and assure back pay for federal workers?
Well, thank you for that question, because we get that a lot. And let me just be as clear as I can. Every day we ask the Republicans, because this is a Republican shutdown. You just heard my colleague Emilia Sykes talk about some of these things, but that they could be doing and what we're doing. So every day we're actively asking them to sit down with us. Let's negotiate a package, because they are in charge. We've also been trying to make sure that we educate everyone to understand what the shutdown is and why we need you to join us to put pressure on our Republican colleagues who run the Congress. Every single day, we have an opportunity to hear from you. We're holding hearings where people are flying in from all over the country. And many of them are saying not only thank you for fighting, but continue to fight. Right now, they're not giving us anything. You've heard what it does to a family of four in my district. You heard what it does in Shontel's district and what it does to SNAP and Medicaid and Medicare. So we are asking you to join us and put that pressure on Republicans about how important it is to reopen the government and to give us the health care extensions and not giving the tax breaks to billionaires. Now, you asked a good question about federal workers and their back pay. So let me say this. Back pay for federal workers is guaranteed under the Government Employee Fair Treatment Act, which we all voted for, and it passed, and it was actually signed into law. So federal workers are guaranteed under the law for their back pay. And so we are going to make sure that we're continuing to uphold the rule of law in the government. And trust me, there will be attorneys on standby to make sure that the federal workers are guaranteed. Now, unfortunately, for federal contractors, they are not guaranteed back pay. So that is why I recently co-sponsored HR 5657, and it's the Fair Pay for Federal Contractor Act of 2025, which would ensure that federal contractors also receive back pay. And that's just to highlight a few of the things that we're doing. We're also listening to our constituents and seeing what they want us to continue to do. And I can tell you, people are hearing our message. They are asking us to fight, because right now there's so much at stake that Republicans are refusing, but we know it's hurting their constituents too. This is about people and priorities. This is not about partisan politics. Republicans are in charge, and it is a Republican shutdown.
Thank you, Congresswoman. Our next question will be for Congresswoman Brown. William from Cleveland asks, will the House return to session next week?
Well, William, I sure hope so. We haven't voted since September 19th, and Speaker Johnson has had his Republicans hiding for a month. I mean, Democrats have been on duty. We've been in the White House. Our offices are, I'm sorry, we've been on the Capitol. Our offices are open. And Republicans have been on vacation. So we're ready to work. We've been showing up and speaking up and standing up and fighting for you. So I sure hope so. But it is up to Speaker Johnson.
Thank you for that. At this time, we'll go ahead and take some calls, some questions live from some callers. We'll go ahead and start with Mary, who joins us from Columbus. Mary, you're live on the call. Please go ahead with your question. Mary, you're live on tonight's call. Please go ahead with the question.
Yeah, I was just wanted to know what if the calls that are going into the House from constituents are having an impact, and how much of an impact.
Well, I'll jump in and start on that. I can tell you absolutely it's having an impact. We are meeting with people who are experts in polling and talking to people. And the American public is on our side. And let me tell you why. Because the more we do our town halls and our meetings, they understand that we're fighting for everyday people. Because with this administration, and I'm going to say this because it's a fact, it's not partisan. With this administration and this president, I believe he's a bully. So he is holding hostage Speaker Johnson and other of my Republican colleagues who have an obligation and a job to do their job. And so the American people are saying they're already trying to cut our services. They're trying to hold our back pay. And for what? We need our health care. I mean, and there's so many stories we hear about people flying into our hearings talking about they have sick children and how they depend on their Medicaid, how they depend on SNAP. We have doctors and nurses who are coming and saying rural hospitals could actually and will close. And you'll have clinics that serve people that will close. And let me just end by saying this. There's not a Medicaid doctor or a Medicaid nurse. So when they close hospitals and doctors and nurses aren't employed, this is going to affect those of us who are on this call. All of us are affected by this. And so, yes, I think people are saying, please fight for me. And we're proud that you're fighting for us because we have nothing to lose. And I believe the more people who ask that question and join us, that Republicans will realize that they are affected. And we've actually had Republican colleagues with children who need the services to start having a change of opinion. So, yes, it's worth it. And thank you for being in the fight with us.
Thank you, Congresswoman. We'll move to our next question, who comes from Charlene, who calls in from Akron. Charlene, you're live on the call with the Congresswoman. Please go ahead with your question.
Hi, thank you for taking my call. I'm concerned about the Medicare premium, if that's going to continue to rise for those of us that are chronically ill with Social Security, and I've no longer received Medicaid because they said that my check was too high. However, with the cost of living increases with everything, I don't foresee being able to afford even the $184 when I see a specialist paying co-payments of $35 and $50 in tests at least 3 times a month, and having over $1,000 in premium expenses in just a 3-month time frame.
Thank you so much for coming on today and sharing your story. And I hear you, and it's part of the reason why we are digging our heels in on this fight for people like you who are experiencing the same thing. The Affordable Care Act tax credits help folks like you. Like I mentioned before, there are 29,000 people who receive these, who are on the marketplace, and 90% of them get the tax credit. And so some folks have premiums as low as $10 a month. I remember we posted that on our website, and someone called in to say they think we made a mistake, and it was not a mistake. If people qualified for it, that was the purpose of it. And we need people. We need as many people as possible to get health insurance so that they can take care of themselves and their families. But part of why we are having this fight is exactly what you just identified. You are not alone. There are people like you all across this country who simply cannot afford their premiums to increase 100%, as we are seeing in some cases, or their plans being eliminated altogether, as we have already seen with the alt care. There is a bill, the ACA, extending the ACA enhancements tax credits bill. I have signed on to. I'm pretty sure everyone on this call has as well. It would extend these credits permanently. And so we wouldn't see those giant spikes as we are planning to on November 1st. But that is an issue. And I know you mentioned, I just want to touch on it because you mentioned Medicaid, but you may no longer be on Medicaid. But one of the things we saw from the big ugly bill was copays for people on Medicaid. And again, these are not things that people can afford. And so we are talking about a holistic conversation about what can people afford in America. They can't afford gas, groceries, housing, and healthcare is now the latest skyrocketing cost that people cannot afford. This is unsustainable. And we are telling our colleagues on the other side of the aisle, please work with us to make sure people can afford to live comfortably in this country. You mentioned Social Security, and I just want to say something quickly. Social Security checks will continue to go out. They do have furloughed staff, so if you have new questions to ask them or new determinations, you may not be able to do that. And Social Security offices have been directed not to communicate with congressional offices. But if you receive a Social Security check, if you have already been on the rolls, they should still be sending that. That comes from a separate pot of money, so you should not be lost out if you have Social Security. But again, thank you for sharing your story and asking that question.
Thank you, Congresswoman. Our next question comes from Jackie, who joins us from New Franklin. Jackie, you're live on the call with the Congresswoman. Please go ahead with your question.
Hi. I work for a local children's hospital here in Akron, Ohio, and our grandson sees some of the providers there. He currently is on a waiver through Medicaid. Do you know what will be happening to the waivers if Medicaid does get cut?
Thank you for the question. Unfortunately, I do not know the answer to that question right now. And the reason that we don't is because the state Medicaid department has to navigate and figure out what they want to do and how they're going to implement the Medicaid program with this $1 trillion cut. So some of the services that people may be connected to or used to may not be available. There are some mandatory requirements for older adults, for children, for people with disabilities. However, some of the ancillary services, for example, transportation or food or respite care, may not be available. So that is a very concerning issue. I know waivers are very difficult to get. There are wait lists for them, and a lot of families wish that they had them so that they can provide particularly in-home care, but sometimes out-of-home care. But we don't know what the state Medicaid department is going to do, what they are going to cut in order to make this work out for patients across the board. But it is something that we are very concerned about. But please stay in contact with my office, sykes@house.gov. We are asking that question almost weekly. And when we get the information, we'll push it out as soon as we possibly can.
Thank you, Congresswoman. Our next question comes from Susan, who joins us from Columbus. Susan, you're live on the call. Please go ahead with your question.
Well, thank you. First of all, thank you all for being here and being in this for all of us. Here's my question. Any of you feel free to take it. What can we do to get the Democratic message out? Corporate media is not covering this crisis in a way that conveys the urgency. Unprecedented does not convey the attack on benefits and everything else that is happening during the shutdown. Thank you.
Well, I'll jump in and then others can. And that's a good question. We actually have talked to experts about this in the communication field. And you're absolutely right. What I would call traditional media does not always get it at the urgency that we want or our message clear. But what we have discovered is if you break it up in pockets, if you will, we have a younger generation of folks that aren't looking at traditional news anyway. And as you know, we fought hard to keep those college students up to the age of 26 on their parents' insurance. So when we look at a younger population, they're all into social media. So we are in our caucus doing non-traditional media, explaining it and what we're fighting for and why. And we believe, or I'm comfortable saying, we know that's working because we're getting people to repeat our message or writing in saying thank you and stay in the fight. Here's the part that I believe is so important for us to not give up because it's working. I am sure you're very busy. You got on this call tonight. Thousands of people have signed onto this call, and we're doing this across the country, not just here in Ohio. So we need you to repeat our message. So if we get everyday people repeating it, if we get doctors and nurses and school teachers and artists, and those who have children or family members who are receiving these services to tell their stories. That's compelling. And you have to tell those stories not just to Democrats, while it's our Democratic message, but to the Republicans who are responsible for, as the last caller said, afraid that she's going to lose her Medicaid services. And people are now afraid about Medicare and Social Security, and especially those who have children or parents with chronic diseases. Tell those stories and how you have to use the language that we're holding Republicans responsible for this Republican healthcare crisis shutdown. And I applaud you for calling and holding us accountable. And we will do that and continue to increase and do a better job of reaching out to everyone with our message.
Thank you, Congresswoman. I'm going to move to a written question for Congresswoman Brown. Daryl from Cleveland asks, how do the SNAP interruptions impact the disabled community?
Oh, Daryl, thank you so much for the question. USDA said this week that the state should not expect SNAP funds for November. So I am very concerned about this, especially for our disabled neighbors, children, and the elderly, who make up a huge proportion of people on SNAP. So we're going to continue to fight. We hope that we can get this to not be an issue. All we need is for our Republican colleagues to show up for work, and they can stop this shutdown today. Again, Democrats are ready, willing, and ready to negotiate. And I think that it's on the Republicans right now to make sure that they are listening to their constituents. The thing that I think is most compelling is about 76% of the people who are impacted by these cuts come from districts that Trump won. So this is not a partisan issue. This is not, again, a red or blue or Democrat or Republican issue. It is an everyone issue, but it is Democrats that are fighting to protect the everyday people. So thank you, Daryl, for the question.
Thank you, Congresswoman. We have time for one more question, and we'll direct this to Congressman Lansman. Danielle from Cincinnati asks, how do you plan on protecting vulnerable communities that are being stripped of health care?
Yeah, that's why. Thank you so much for that question. This is why this fight is so important. It's difficult to convince our colleagues to show up, which is frustrating in and of itself. But then to get them to appreciate the fact that this isn't something that's just happening in some parts of the country or in my district or Emilia's district or Joyce's or Chantel's. It's happening in every single district, meaning that folks are losing their health care. And these are young people and they're farmers and they're small business owners, their families, it's children, it's everybody. And so there's sort of three parts to this. One is winning this fight right now on the Affordable Care Act subsidies. It's 24 million Americans who are going to see their healthcare costs skyrocket unless we extend these subsidies, and that's immediate. We have to do that right now. Number two is that we have to reverse the cuts. They took out close to $1 trillion in investments in Medicaid. I mean, just think about how destructive that's going to be. And Joyce said it really well, which was there's no such thing as a Medicaid doctor or a Medicare doctor. These are doctors, and so when those folks go, or a hospital shutters its doors, and the doctors that serve those hospitals are no longer able to work there, and they leave, everybody in that area loses healthcare. So restoring those Medicaid cuts, number two, and then number three, we have to stop this nonsense of cutting healthcare. After we win these fights and protect people's healthcare, we have to expand investments in our healthcare system. That includes, it's not limited, but it includes these reimbursement rates to Medicaid and Medicare, so that the cost of increased care isn't put on individual Americans, but rather Medicaid and Medicare cover those additional costs, so that nobody sees their healthcare costs go up, especially those folks who can't afford it. So those are the three big things, and it really does mean we have to win this fight on the subsidies, so that we can then move to reversing the cuts to Medicaid.
Thank you, Congressman. Congresswoman Beatty, I'd like to turn it over to you for some closing remarks.
Well, first, let me just say thank you to everyone who's listening to us tonight. We are very hopeful that we've been informative and that you really see that we are passionate about this. And no healthcare, no vote is what we believe in. And I want to personally thank my colleagues and friends, Congresswoman Shontel Brown, Congressman Greg Landsman, and Congresswoman Emilia Sykes for joining us tonight, because this shutdown is about people and priorities. And while Republicans stall, Democrats are standing up to do these three things. I keep this sheet because it's so important for us to cancel the Republican cuts, lower the costs, because Republicans are giving it to billionaires, because we want to save your health care. And it's very important for you to know, you've talked about Medicaid. They're slashing Medicaid with the largest cut in history. They're dramatically raising premiums and copays and deductibles for tens of millions of Americans. And let me just tell you, they are setting into motion $536 billion of cuts in Medicare. And they're even shutting off medical research, including research for children, kids with cancer, vaccines, and public health. So we are in this to fight for you and to stand up with you. And let me just again say the two most powerful words I can say: thank you. Thank you for being with us tonight. And the fight will continue, and we will be with you to the end.
Thank you, Congresswoman. And thank you to all of you for joining us on today's telephone town hall with Congresswoman Joyce Beatty. If you would like to stay up to date on the Congresswoman's work, Please follow her on Facebook, Instagram, X, and YouTube at Rep Beatty. If you would like to subscribe to her e-newsletter, just stay on the line and leave your name and email address after the tone. Thanks again for joining us. Have a good night.